Good afternoon. My name is Dr. Samar Gupte, and I am a gynecological cancer surgeon and a gynecological cancer specialist attached to the Surya hospitals in Mumbai. Today, we are going to talk about cervical cancer. The reason we are talking about cervical cancer is that in India, even today, it is the second most commonest cancer amongst women. We see almost 1.25 lakh women with newly diagnosed with cervical cancer a year all over India. And this is quite a large number because it translates to almost one woman being diagnosed with cervical cancer every 10 minutes in India. However, this is not all gloom and doom. The most fortunate part about cervical cancer is that it is by far the most preventable cancer. More than that, it is a cancer which can be detected early, and if detected early, it is almost curable. So I think I wanted to talk to all of us about this so that we can actually spread the awareness. So what happens with cervical cancer is that the main cause for cervical cancer is the presence of a virus known as the HPV, which gets into the cells in the cervix. The cervix is actually the lower part of the uterus, or called as the mouth of the womb, the mouth of the uterus. And over a period of 15 to 20, 25 years, it can give rise to cancer. Now, over this period of 15 to 20 years, the cervical cells undergo a lot of changes, and these changes can easily be picked up in regular routine examination, and therefore we can act on them and then we can sort of treat them. Some of the common symptoms that we see for cervical cancer are irregular bleeding, bleeding that is not happening monthly, but between two periods when women have bleeding, bleeding that happens after intercourse. Another very, very common symptom that women have, which of course can be common for many conditions, is discharge. They complain of discharge happening through the vagina. This could be a whitish discharge, it could be a yellowish, brownish discharge. So these are symptoms which may not necessarily point towards a cancerous process. It could be just a plain infection, but it needs to be evaluated and taken care of. At Surya Hospital here, we run a dedicated clinic where we actually evaluate all these symptoms and also check for them and check and do the diagnosis whether it is precancerous or cancerous. The best thing that we can offer our women is a pap smear at every visit. A pap smear actually looks at all the abnormal cells that are there in the cervix and lets us know what these cells are. We can also check for the presence of the HPV virus, which is called the HPV DNA testing. And in the presence of any of these abnormalities, we also offer patients a small but very fantastic procedure known as a colposcopy, which can be done right in the clinic in the OPD itself. Does not require anesthesia or admission. It takes 5 minutes to do it, and we can actually come to a conclusion as to what disease the patient has or whether they have a disease or not. So these are some of the things that we offer routinely at Surya, and we can check for the presence of cervical cancer. Also, at a place like at most of our hospitals here at Surya, also, once we detect the presence of a disease like cervical cancer, we offer them CT scans to check out the extent. And if it's an early stage disease, we also have all the infrastructure ready for surgical surgery. The surgery that is required is a little bit of a difficult surgery known as a radical hysterectomy with lymphadenectomy, but we offer that. We've got wonderful operation theaters, and we can do that. And we've been doing that routinely for all our patients here. This all this may sound very expensive, but we have a solution for that also. Uh, I can give you a small anecdote. You know, in one of our OPDs, I was sitting and a lady walked in and she had this irregular discharge coming. When we evaluated her, we found that she had an early stage cervical cancer. So obviously, because she was in the early 50s, we did all her scans and we looked at the disease and we realized that she's amenable for surgery and that can be, you know, it can do her a lot of good. Unfortunately, she belonged to an underprivileged society and could not really afford treatment. So we have a solution for that. At Surya Hospitals, we have an excellent project which is ongoing called the Saksham Project, in which we help all these women from underprivileged societies with all sorts of cancers, not just cervical cancer, but other gynecological cancers also. So we fit this woman into the Saksham Project, We actually operated on her, and now she's very happy and doing well. So this is one of our excellent success stories where even women from underprivileged and other sections of society can benefit with treatment. Uh, so my urge to everybody is that, this is a condition or a disease that can be caught in the precancerous period itself. It doesn't need to be uh, we you know it's not a cancer that is caught in the later stages. It is something that we can catch in the precancerous stages with regular checkup with your doctors. So please go to your doctors if you have a white discharge happening, or an irregular periods happening, or bleeding after intercourse happening, and one can catch cervical cancer even before it has started. There is a question that I would like to answer. They've asked what type of cancer is cervical. Well, as I said earlier, the cervix is the lower part of the uterus of the women. It is actually the mouth of the uterus, and it is located inside the vagina. So the cancer of that part is called as the cervical cancer. And as I said earlier, it is by far a very common cancer. In fact, in India, it is the second most commonest cancer, the commonest being breast cancer. If you look at what are the treatment options that are available for cervical cancer, well, the treatment options are many. Cervical cancer is a treatable disease, so make no mistake about that. It can be treated at all stages. The treatment that can be done in the first stage itself is surgery. Surgery is the best thing that we can offer in the first stage of the cancer, or maybe early second stage also. But after that, the treatment is predominantly radiation and chemotherapy related. And these forms of treatments can also give excellent results to patients. At Surya here, we offer state-of-the-art preventive oncology, which means evaluating women for the presence of precancerous and cancerous lesions, detecting abnormal pap smears, colposcopy guided biopsies. We can offer them CT scans and state-of-the-art surgical care. One of the other questions that often people ask are what are the possible side effects of treatment in short term and long term? Well, as far as one has to understand that when it comes to treatment of cancers, cancer is a it's as they say in Hindi, bhayankar bimari hai. So if the treatment is bhayankar, then if the disease is bhayankar, then the treatment is also going to be aggressive and a little bhayankar. So if you look at those patients who come to us in early stage and we offer them the surgical treatment only, the long term side effects are very minimal. Short term, yes, they are admitted with us for 5 to 6 days. Then they go home. They have to rest at home. It takes about 13 to 14 days for them to recover. Sometimes during recovery, they have a bit of urinary problems, but eventually, within 2 to 3 weeks, everything settles itself and they are back to their normal routine. Absolutely, they can go back to work. They can travel by train. They can do whatever they were doing regularly. If these women do require a bit of radiation therapy or chemotherapy after that, then yes, they can have a little bit of long term effects, but these are also manageable. These effects would be something like, they have to go and pass urine more often, or they have to go to the toilet a little more often. And these can be the side effects of radiation. Sometimes there's a little bit of skin darkening because of radiation. So these are some of the very minor side effects, but these all patients recover from all these after finishing the therapy within the next 3 to 4 months. So there is nothing that is permanent. Yes, there are a few side effects, as I said, but one can always overcome them by regular treatment and listening to your doctors. Uh, Fortunately, in today's day and age, all the treatment that we give is not absolutely as per the book. We look at individualization of treatment. We do treatment which is evidence based, but we cater it to the patient. We understand the needs of the patient. The treatment is different if the patient is heavily diabetic or patient is little obese, but in no way do we compromise on the care of the patient. And we do it in such a way that we reduce the side effects to as minimum as possible. And and the effect, that is the cure, or we move to try and take the patients as closer to cure as possible and try and get them to the healthiest that they can. So another question that people often ask is what type of radiation therapy is recommended. So first of all, let us understand what radiation therapy is. Radiation therapy is where high dose X-rays, I'm speaking very literally, high dose X-rays are bombarded onto the area where the cancer is or was, and so as to kill all the cancer cells. That is high dose radiation that is radiation therapy. Now, typically for cervical cancer, there are two types of radiation. One is called external beam radiation therapy, where the patient sleeps in a machine which looks like a CT scan machine for literally 5 minutes or so, and radiation is given to them. This is done practically every day, maybe 4 to 5 days a week for about 6 weeks. So this is the entire external radiation. And sometimes we also need to give radiation to within the vagina to the cervical growth itself or to the vaginal vault, and that's called vaginal brachytherapy. But this is the entire gamut of radiation therapy that may be recommended for cervical cancer. Uh, Very rarely do we need to give chemotherapy also. That's only if the disease has spread a little bit more, and then one gives chemotherapy. Chemotherapy, as we all know, essentially is medicines that are injected into the veins and they act all over the body to try and kill cancer cells. Of course, they have their own side effects in terms of depending upon the drug used, hair loss and other things. But remember, all these side effects disappear the moment the treatment is stopped. Within 3 months, if there has been hair loss, that will also come back. So I think, in today's day and age, our treatment protocols have progressed quite a bit, and we offer our patients very good care. In fact, we have excellent counseling sessions that we do to our patients here at Surya Hospital every afternoon between 2 and 4. So all patients with irregular vaginal discharges, irregular bleeding can come here, and we can offer them the full preventive check as well as counseling and telling them how they can go ahead with their treatment or their testing. Uh, a question that is asked today is, what is the chance that cancer will come back? Should I watch for specific signs or symptoms? So, well, no cancer can be termed as absolutely cured or treated, because finally we know that there is, even in the very earliest stage when we offer the best of treatments, there is still a 5% chance or a 3% or a 7% chance that the cancer can come back. So typically speaking, we tell our patients who've been treated for cervical cancer to look for the same symptoms that they had before. If they have any irregular bleeding, irregular discharge, if they have persistent backache, if they have trouble passing urine, if they have trouble passing stools. So these are some of the things that they have to look for. And if they have that, then they need to come to us for evaluation. But more than that, what we actually do is we do a preemptive evaluation. So when a patient finishes with treatment with cervical cancer, we don't just tell them that that's it, go home and we are done with it. There is a protocol that we follow and we ask them to come to us for regular checkups. So the initial protocol states that they come to us every 4 months for an evaluation, whether they have a problem or not. We evaluate them. We talk to them. We do a clinical evaluation. If required, we can do a sonography or any other evaluation and see whether they are fine, whether the cancer is coming back or not. So we call them practically every 4 monthly. That is, almost 3 times in a year, and we do this for the first 2 years. At the end of 2 years, if they are disease free and everything is good, then we call them every 6 monthly for the next 2 years. And once 4 years have gone by and the patient does not have the disease, then the chances that the disease comes back is very low. Of course, it can come back, but it's low. And then we still evaluate them, but we call them back every year for the same checkup. And we tell them that in between, if they have any irregular bleeding, pain, backache, persistent urinary complaints, bowel complaints, they need to come back to us and we can evaluate them and try and detect if the cancer has come back. So the most important thing is, whatever we do, try and catch it early. So even if the cancer has come back, if we can catch it very early, quickly, when it has just come back at one point or two places, then yes, we can offer cure and treatment for that also. But if patients neglect and they come back to us after when it's very late and it's spread all over the place, then it becomes a little more difficult to offer the best of treatment for them. So follow up is very important. So basically the urge is that for all of us to just look at our own symptoms. Any discharge, any irregular bleeding, these are the first signs that all women should come to us or come to the doctors for evaluation. As I said, the best thing that we can offer our patients is a pap smear at every visit. The moment a pap smear is done, it makes things pretty clear. In fact, all over the Western world, the incidence of cervical cancer has dropped because of regular pap smears. There's a question that says, will this treatment cause early menopause? Well, yes, it does. So the very fact that one does a surgery and removes the uterus, uh, there'll be no more bleeding, there'll be no more periods. Of course, in younger women with a type of cervical cancer called squamous cancer, we can preserve their ovaries inside and they may not become menopausal. But generally speaking, if radiation is required or the women are above 50 years of age, then yes, the treatment is likely to cause menopause. One of the important things that I want to bring about awareness to everybody is the presence of, how preventive oncology or preventive care is important for cervical cancer. I've been speaking about pap smear to everybody. The other thing that I think we need to focus on is the vaccine, the cervical cancer vaccine, which is known as HPV vaccination. HPV vaccination is with us for quite a few years now. It's getting more effective, it's getting better now. And I think it should be offered to all of us. We at Surya here can offer vaccination as per the policy that has been laid down by our organizations. Currently, we have different kinds of vaccines, but they have been sanctioned only from the age of 9 to 26 for a particular type of vaccine. And there's another type of vaccine for which is sanctioned between the ages of 26 and 45 also. So I think this is something that we should tell our daughters, our sisters, our nieces to consider, because this will go a long way in preventing cervical cancer for them. Uh, if you want more information about it, please do come to Surya, talk to us. We can show you statistics. We can show you, we can show you paperwork that clearly shows how effective it is. We've also been, looking at, and millions of women have been vaccinated over a period of time, and it is very, very beneficial to them. I have another question which says, what are the risk factors? So the risk factors for getting cervical cancer, well, they honest to God, the risk factors are quite a few. The main risk factors for cervical cancers are starting intercourse at a very early age, having multiple sexual partners, having unsafe intercourse. These are some of the commonest factors that give rise to cervical cancer. Smoking reduces the immunity in the cervical cells, and as a result of which one can get cervical cancer. So smoking is a big risk factor. Unhygienic condition, they have known to be a risk factor. So these are some of the common risk factors that we look at for that. There's a question which asks, what can we do to stay as healthy as possible during and after treatment? Well, the best thing that you can do is look after your sleep and your nutrition. I think that is the best thing that one can do. Get good regular sleep, which is at least 7 hours a day. And nutrition, I think a high protein diet is very, very beneficial. If proteins is something which you don't have in your diet, then I would suggest that, any protein powder that can help you with increasing your protein content, that would be beneficial. The other thing is getting some form of exercise regularly. So during treatment, it may be difficult to go for a walk or something like that. But once treatment is done, join an exercise program nearer to your place, join a gym, go for regular walks, do a yoga program, something that keeps you healthy, uh, improves your appetite so you can eat regularly and sleep well. I think those are the best things that we can do. Some of the other things that one does is we urge our patients to not only come to us for a regular checkup, but also do blood tests and see that your sugar is under control, your other parameters are under control, get your blood pressure checked, because these things also play an important role in facilitating recurrence of the disease. So these are some of the things that we look at. So maintain as healthy a lifestyle as possible. Obviously, stop smoking, which is prime essential to prevent return of these cancers. So basically, it's a lifestyle and a lifestyle changes that is going to make most of the difference to the health of our patients. So, coming back to preventive oncology, because the reason I keep telling about preventive oncology is that once the disease has come, yes, there are treatments that are offered, but yes, it's disease that we're treating in the patient, and then there's always a chance of recurrence. But the whole idea is that if you can prevent the disease from happening or catch it before it happens, then the treatment can be curative, and one can be cured if you catch it before the disease actually comes in. And that is where vaccination, regular pap smears, is of great benefit. So we actually, our organization, the OBGYN organization of India called the FOXY, actually recommends that all women should have a pap smear after the age of 30 every 3 years. And for those who do not or do not have a chance to go to their doctors often, whenever they come to us, whenever they come to our doctors, we actually offer pap smear because it can be done in the clinic very early. So these are some of the basic things that we wanted to discuss regarding cervical cancer. So for those who joined in late today, I'll just kind of recap for you all. uh, Cervical cancer is the cancer of the lower part of the uterus called as the neck of the womb or the opening of the womb. That's the cervix. Cervical cancer is something that does not happen overnight. It happens over many, many years. So there have to be risk factors present, like we spoke of earlier. That is, early age at sexual intercourse, multiple sexual partners, early age at having children, multiple children, unhygienic environment. These kind of factors will facilitate it, smoking, and unhealthy lifestyle. So, in the presence of these factors and in the presence of an HPV virus in the cervix, the cervical cells can undergo changes over a period of 15 to 20 years and give rise to cervical cancer. So, these are some of the things that we have noticed scientifically over a period of time. Um, because this cancer takes a long time to present itself, regular checkups and regular going to your doctors or coming to us regularly will help us catch the disease in its early stage or catch it in its precancerous condition, which is even better. Once we diagnose cervical cancer, which is usually diagnosed by a biopsy, obviously what we offer is a scan, an MRI or a CT scan or a PET scan to figure out whether the disease is in one place or in many places. With a localized disease, which is early stage, then we offer the patients surgery for the same, which is a slightly major surgery, but we have excellent equipment and excellent doctors, and we do it. It can be done competently. At the end of surgery, obviously, some patients are cured and some patients may require additional therapy in the form of radiation or chemotherapy. So, this is the entire gamut of treatment that we can offer for cervical cancer. At the end of that, we ask our patients to come for a follow up every 4 monthly for 2 years and then every 6 monthly for 2 years. We encourage our patients to maintain a healthy lifestyle, and we look after our patients. We talk to them often. We uh, you know give them questionnaires so we can they know that we are on top of it and we are with them.